have a swimming pool at home that I thought would be really nice so I could spend some quality family time. I've never really been in it. I watch my kids from a distance. I don't get to participate.
Eventually, my son and I got to know another family that was dealing with eczema, and that was huge.
I explained to people that my eczema is a chronic inflammation under the skin.
This is kind of a new finding for me. It makes me feel like I'm not alone. There's going to be more work on my part because I am not just a victim.
I don't stop activities with my grandchildren because I have eczema. I have decided I'm not going to let this eczema stop me from doing what I want to do.
Good evening, everyone, and very welcome to our very first atopic dermatitis or atopic eczema support group Facebook session for, well, we've actually expanded to YouTube now as well, as you know, and Instagram. So our first one for this year. Before I forget, because I always forget that, well, first of all, I probably need to introduce myself again. I'm Dr. Sarita Kannenberg. I'm a dermatologist here in Cape Town. With a particular passion for atopic dermatitis, atopic eczema, as you know. And before I forget the next thing, I need to please ask you to remember to post your questions. This is your opportunity to post your questions throughout the meeting. We will be addressing them throughout, and then we will we'll obviously have some more questions and answers at the end as well. And we will get to all the questions and answers. And then I have the wonderful privilege to introduce you to Dr. Tulja Trimkanji. She is from Cape Town as well. So Cape Town's a very good place to be if you have atopic dermatitis or allergies, because you have the both of us here. So then she is actually a pediatrician, but she does work with adults as well because she's also an allergist. So that means that she's a highly qualified allergy specialist as well. And she works at Grooteskeer UCT Lung Institute, which is a very special unit that we have here in Cape Town, where very complicated cases are managed. So very welcome, Tulja. It's lovely to have you here tonight. And thank you for giving your time. And I know that this is also something that's really close to your heart as well.
Yes, absolutely. Thank you so much, Sarita. Thank you to EFSA for having me. And as you said, atopic dermatitis is something extremely close to my heart. And I'm so happy to have this opportunity to chat to people on a real live platform where we can make a difference. Because I think education, when it comes to conditions like atopic dermatitis, goes a long, long way in managing patients, apart from just some of the therapies that we use.
Absolutely. I think because that's one of one of the simple things that I've come to realize in my very short time as a dermatologist is, and actually as a doctor probably, is, you know, as well as I do, if we prescribe things and people don't use it, then it doesn't work. So, so it's really important for people to be well informed and also to know their rights and to know when they can ask for what. But the first thing, before I think we go on to, I'm just straying a little bit of the next step that we're going to talk about, but maybe we can just explain, because I'm sure that there are people out there who is saying, who are saying, atopic dermatitis, what is that? Is that the same as eczema?
So, you know, eczema is something that we consider an umbrella term. There are different types of eczema, but, and I'm going to say this in a very colloquial manner from my personal experience, but also I think literature does suggest that most eczema is atopic. You do get other types of eczema, but most of the eczema we see is atopic. And I think this is where the education comes in, because a lot of people think that, you know, it's a problem on my skin and it's just on my skin. And the first thing I always say to people is your skin is the largest organ in your body. So your skin is actually, whatever is manifesting in your skin is quite systemic. And if we go back to the systemic nature of atopic dermatitis, just the word itself, atopic means allergic, and dermatitis is basically inflammation on the skin. So I always start with explaining to people that, yes, what you see is actually what's happening at the top, but there's a lot going on underneath. We're actually seeing a manifestation of it. And the best way is, I say that atopic dermatitis is actually a systemic disease. And what we see, I think this is more for medical term, where you get a cutaneous manifestation. So you're getting a manifestation on the skin, but actually a lot more is going on underneath.
Yeah. So are you saying that this is like having high blood pressure and having diabetes? It's the same type of chronic condition?
Absolutely. I personally think, and I think you and I both know, we see patients like this every day. I mean, we see this in our personal capacity, but I mean, we've seen research in this as well. With people with eczema or atopic dermatitis, I think for the purposes of the talk, let's use the word eczema, even though we're talking about atopic dermatitis, it would just be easier. But most people who have this actually have likened it to other chronic illnesses. So, you know, some of this research has shown that somebody who has eczema says that it affects them as much as somebody with heart disease, as much as somebody with depression, as much as somebody with anxiety disorder. So when it comes from the patient's point of view, actually, really, it is something that can have a manifestation in much more than the skin and have an effect as much as high blood pressure or any other chronic illness for that matter.
Yeah, yeah. And then it's very important that these things that we are talking about tonight, that people also take that, you know, on and remember that it is a chronic condition. And if you feel unwell when your skin has a rash, an eczema type rash, the doctor tells you have eczema, then that's completely and that we should recognize that, and people shouldn't think that there's something wrong with them, you know, it's in their minds, for example, or that. Okay, so let's move on to what is this inflammation that you were mentioning. If you can tell us a little bit more about that.
Yeah, so inflammation, essentially, you get all types of inflammation, right? But we say when we go back to originally, I said the skin is the largest organ in the body. The skin is the largest organ in our body, and it's part of our immune system. So our immune system is basically the defense that our body has to anything. I think everybody knows about the immune system after the COVID pandemic. And this is basically what is used to fight off bugs. It's used to fight off anything that our body deems as an external threat. Now, when you have, and I'm going to use allergies as an example because that's my field and that's one of the common causes of eczema. When you have an allergy to something, basically what it means is that your body is now seeing something that's in the air or the environment or in a food as a threat. And when your body sees it as a threat, what's going to happen is your body is going to respond to it as though it's a threat. So your body and your immune system is basically going to trigger off a response. Now, those responses, and this is where my wanting to explain to people how atopic dermatitis is systemic comes in, is this reaction can occur all over in your immune system. So often people would go to a doctor because they see either a rash or they have eczema or they see something on their skin. But actually, when you're reacting to something, your immune system is reacting, which means your eyes would react, your nose could react, the inside of your mouth or your lips could react. If you eat something, your tummy could react as well. If you're badly allergic to something in the environment, all those people who have chest issues or nose issues when it comes to seasonal, a very, very similar thing happens when it comes to dermatitis on the skin as well. So your body is going to say, hold on, and let's just use something like dust mite as an example, because we're in winter now. And in winter time, we know people have more blankets and more pillows, and we take out all our jerseys and jackets that have been laying in the cupboard all year. Those things are all full of house dust mite. So what's going to happen is if you are allergic to house dust mite, which is something that's in the environment anywhere in the world, you're going to be exposed to it. Very difficult to not be exposed to it. Very difficult to avoid. The minute that touches your skin is going to trigger off a response. Your immune cells on your skin would be released. And this inflammation we refer to as type 2 inflammation. You get different types of inflammation, but with type 2 inflammation, basically they are substances or they are defenses in our body called cytokines. I always explain to patients that they're just basically little soldiers that are fighting off something that is not supposed to be there. Chemicals get released, and then all of these chemicals trigger off a whole bunch of reactions, one of them being inflammation. That could be redness, it could be itching, it could be dryness, it could be weeping on your skin, depending on how bad or moderate your eczema is. You could have different stages of this inflammation. And basically, eczema is a cycle where this inflammation is constantly occurring. So coming back to what you first said, Sarita, about how it would be something like blood pressure, is actually yes. Because when you have hypertension, there are times when your blood pressure is going to go up because you might be stressed about something, you might have gotten an infection, you might have eaten something that might have triggered it off. And with eczema, yes, even though we just see the inflammation on our skin, all these factors can make you go through a spiral of ups and downs and ups and downs and ups and downs.
Yeah. And those spirals, all of those that inflammation that you have going around in your body, it affects the rest of the body as well. And the one place that we always forget about is that your brain actually kind of floats around in all these chemicals. And that can actually, and we see this a lot, isn't it true, that we see that people become depressed, and that people are just that they are that they're depression and anxiety and all of those things, unfortunate things, they unfortunately become a problem.
Absolutely. I see, I often say that the problem is when somebody has this type of inflammation. Since we were talking about the inflammation, it would affect the whole body. But the skin is really special. And I think you as a dermatologist would know that. Because it's something that's so visual and it's so visible, a person wouldn't necessarily see inflammation in their throat or in their nose. They feel the quality of life effects, but they wouldn't see it. But on your skin, it's so visible. So all the way from being a little baby, it affects moms emotionally right up until you're an adult. When it's something that you can see, it's something that everybody else can see, it has such a massive, massive, massive effect. And I think that it's often, this is something that I'm so passionate about, the quality of life effects, of something like eczema, because we often just see the inflammation or the dryness or the redness on the skin. But what we don't see is that person who's had to RSVP no to 3 parties that month that they really wanted to attend because their skin was so bad and they were actually too embarrassed to go. Or, the people who cancel holidays because they're just not comfortable wearing a swimming costume or a bikini, with lesions all over their body, or the kids who get teased at school. So those are all such negative effects of eczema and atopic dermatitis that we really need to talk about more. I'm sure there are many patients, parents, and family members that are watching this right now who would agree and who would have this experience and know and are nodding right now.
Yeah. And it's a full-time job almost looking after eczema, hey? So for a mom having to look after a child with atopic eczema, a mom or a dad, whoever is the caregiver, and if it's you as an adult who suffers with it, then it takes a long time to use all the medications. It costs a lot of money to see all the doctors. And all those things that we don't necessarily always think about, but we're trying to make people aware of the fact that that eczema can do that, unfortunately, and that it's important to realize that this is why you're feeling the way you are, because you have atopic eczema, and we can do things about that now as well, which is also amazing. And we're going to be getting to that very soon. There's a patient that you saw, isn't that you'd like to tell us about?
So just branching into us talking about the emotional burden, I think, like I said, there are many people who would relate to what we were talking about. And I actually think it's best to hear from somebody. We see it as doctors, but somebody who's actually experienced this themselves. And we'd like to share, this is actually a young adult whose life has been changed because we now are managing her atopic dermatitis correctly. Her name is Adley. I'm happy to report she's doing really well now, but I think let's hear from her on her journey with eczema and atopic dermatitis.
Hi everyone, I am one of Dr. Trikamji's patients, and she asked me just to share with you a bit about my journey with eczema. I've been struggling with eczema since I was a little girl, but the past few years it's gotten to an all-time high, and especially this year. So I'm just going to jump right in. I'm going to start off with the way it influenced my sleep, because without sleep my energy levels were very low, and since my energy was quite low, it also influenced my mental health, and I would be frustrated and just quite miserable during the day. So I was scratching and itching constantly, so that first of all made sleeping very difficult. And then since my skin was open and covered in wounds and just raw and sore and swollen and red, it made even just lying still on the bed, because I had it on my back as well, that would be uncomfortable. And it also made just daily activities really, it became a burden just to wash the dishes or cook food or wash my clothes. And things like showering became really something I procrastinated doing, because I knew it was going to hurt. Because every time I would shower, the water would sting my skin. So yes, that wasn't a very nice experience. And then also the impact it had on things like my social life. Luckily, I have really good friends who try to understand, but when you have to keep telling your friends, I'm sorry, I don't want to go out, I'm physically too sore and it's too painful just to even put on a pair of jeans, you do start getting a bit depressed, because you see all these things that they're doing that you can't do or join them in, because your body it's really too painful to move. So that, I think that had a big impact on mental health. Just all the time you lose being bedridden and or housebound, and not just the social activities that you miss out on, but also you have to wake up every day and choose another day of suffering, and you don't really know when it's going to end, or if there's any solution, or why it's happening, if you're doing something wrong. So I think that's something that people don't always realize. Eczema can have a really big impact on, since the eczema has a really big impact on self-image as well, and that again influence mental health. So I think I really just like to raise awareness to the impact atopic dermatitis can have on daily lives, and also on mental health and depression. And I mean, I can go on and on about how it influenced or how it had an impact on my finances and my time and my choices, and the long-term effects it has or leaves, even when the flares are gone, the scars and things like the carpal tunnel syndrome and the eyes. Well, because I was scratching my eyes all the time, my eyes have deteriorated as well. But yeah, I hope this video just helped people realize what a big impact atopic dermatitis can have. I am better at the moment, and I'm doing very well. I'm very happy. I'm on a biological drug at the moment, and I'm very privileged to be on it. But hopefully by raising awareness, we can work together, and maybe in the future have more readily available medications or solutions to atopic dermatitis and eczema and allergies and things like that, to help people like me. So yes, okay, bye.
Gosh, thank you so much for sharing that. It just brings everything home, and it really just, I was sitting here having just goose flesh throughout, because it was just so touching. And what is so sad for me is that there are so many people suffering out there, and not even knowing that we can do things about this now, of course. What I found, and it's not just the patients that need to know that we can do things about this now. Sometimes even our healthcare practitioners will also need to be informed about these new treatment modalities that we have, the treatments that we have available now these days. And so one of the things that I also want to ask the audience out there, if you haven't found a doctor that has that you found to be emotionally, well, not emotionally is the wrong word, but to show the interest in atopic dermatitis, because unfortunately there are doctors out there who just don't have the feeling for atopic eczema, So if you haven't found that doctor, please keep on looking. Also on the Allergy Foundation of South Africa and on the Dermatology Society of South Africa's websites, you can also get the names of doctors who have particular interests in this, so that you can make sure that you get to the right person. So I think that's one of the things as well, that keep on looking until you find the doctor. So we have quite a few questions tonight. Thank you very much, everyone, for posting your questions. And we have just the doctor here for that, Tulja, because the majority of them are due to allergies. So you are just the right one. I actually want to start off with the house dust mite question that we have here. I don't know what your, if that's okay, if we can jump to that question first. It was here. It is this lady who, Charlene, who posted that her 6-year-old daughter has eczema around the eyes. She's now become aware of it, and she's been prescribed a particular medication, but she hasn't started it yet because she really wanted to find the solution to the problem rather than using a cream around the eyes. And her allergy test, which I'd be interested to know which allergy test they used, whether it was a prick test or a blood test, to only dust mites. And what can I do? What would your help? What would your advice be in that case?
So excellent question. And thank you so much for bringing that up, Charlene, because, often I see patients because dust mite is something of particular interest to me, but also from my experience, I see so much of this. Sometimes people walk in through the door when they're coming to me for a consultation, and I look at them before I even know what their name is. I look at them and say, you're allergic to dust mite, aren't you? Just from looking at their face and looking at their eczema. And some of them, and I think this must have happened many times, I can't count, people start crying in front of me saying, but how did you know that I was allergic to dust mite and I haven't told you anything? And I've seen so many doctors, and nobody said that that's the cause of the eczema. You see, dust mite is, like I mentioned when I was using the example for the type 2 inflammation, is firstly, such a common allergy to have worldwide. Secondly, it's an unavoidable allergy. So unlike something like cat or dog, where either you have the dog or not, or you have the cat or not, and for those of you who are allergic to pets and have them, I never advocate you get rid of your pets. We have solutions for those as well. I'm just using it as an example. But dust mite is something that we see so much, and it's completely unavoidable because we're lying on our mattresses every night for so many hours, which means that our skin has got direct contact with it. Everywhere we go, you go to a coffee shop, you go to a cinema, you sit on an upholstered chair, you put on a jacket, you travel on an airplane, you're constantly being exposed to dust mite. So if you're allergic to dust mite, Charlene, actually that's all she does need to be allergic to have bad eczema. That is a major culprit in eczema. And basically what happens is every time the dust mite gets exposed to the top layer of her skin, I always like to draw for my patients and just imagine that you've got a brick wall with many different layers of bricks. And you've got the top part of your skin, which is the top layer, and the bottom part, which is the bottom layer. If the top layer gets exposed to something which is seen as a threat, basically you get a reaction at the top. And, we talked about the skin and, how eczema is a cutaneous manifestation. What we see is what's happening on the barrier. So originally, our barrier of our skin is what's there to cause us to have smooth skin, to provide a lipid, fatty, nice, moisturized layer. Now, when you get exposed to something you're allergic to, you might itch because that's your body's normal response. When you itch, you scratch, particularly if you're a kid and you're being exposed to something that you're always allergic to, you're going to scratch all the time. And when you're going to scratch all the time, you're going to erode that barrier. You're going to damage that barrier. And when that barrier becomes damaged, you're left with skin that's not smooth and not soft, and now is dry and lacks lipid. So firstly, you see that, but now this is now a vicious cycle, because now that your barrier is broken, now when dust mite is exposed to your skin, it goes all the way down and it causes more damage. So the damage is going to go down to the lower levels of the skin. So you've got your brick wall, it goes to the second layer, the third layer, and fourth layer. So unfortunately, with dust mite allergy, this is something that is a continuous thing. And Charlene, am I right? Your daughter your child does actually only need to be allergic badly to one thing for that eczema to be bad. Often when it comes to dust mites, there's a lot of things that are recommended on, if you Google, there's a lot of sprays that are sold online, anti-dust mite sprays. As allergists, we don't recommend a lot of these things. We like to recommend what's scientifically proven. So there are a whole host of things that are recommended to decrease dust mites in your child's environment, but also manage your child's allergies as a whole better. So not just the skin. I see you've been prescribed a cream, but if she's allergic to dust mite, I can bet your bottom dollar that she's got hay fever symptoms, and she's got some chest symptoms as well, and she might have some eye symptoms. So addressing the allergy itself would help her skin, but it would also help everything all together. I just want to bring up, Sarita, since we are talking about newer therapies as well, with dust mite, one of my patients, and we're going to talk about the therapy later, but one of my patients who I have put on a biologic with really bad eczema, he's a young adult boy. When he came to me and I saw his results, I said to him, you must have nasal symptoms, I'm pretty sure. And he says, no, I don't. So I examined him, and he had massive nasal turbinates. And he was also quite chesty. I did an exercise test for him, and he was chesty, but he'd never noticed it. It was so bad that he'd never noticed it. He's now completed 6 months on our new therapy, which we're going to talk about. And I got a call from his mom about 2 or 3 weeks ago. And she says, you know what? He was running last week, and he said that his chest was feeling slightly tight. So I said, do you remember what I said to you the first time? I said, if your allergies are this bad, it's not only going to affect your skin, it would affect your nose and chest as well. And she said, we were laughing, because the thing is that the skin is so bad that it trumps everything else. And you don't realize that you're breathing with your mouth. And you don't realize that one of the reasons you're rubbing your eyes is it might be allergic. And because your skin is so bad, you actually don't even exercise. Some people's skin is so awful that they, sweating might cause them itching and pain on their skin. So, the allergy component of eczema is massive. So really, with dust mite, it's a massive, massive cause of atopic dermatitis, and it's one of the commonest reasons I see. I would say to this patient, this mom, that, you need to see somebody that's going to address atopic dermatitis from outside and from inside, so that your child is managed holistically.
The only thing also that I would like to add here is that inflammation that you have under the skin actually keeps on making that barrier worse and worse and worse. So as soon as you treat that inflammation, the outside layer of the skin, which in eczema is almost like a sieve, and just lets everything in, the bad stuff in and the good stuff out. So so as soon as we start treating that, it makes a big difference. The other thing is that Charlene, we're not giving the other patients or the other people their time for their questions yet, but we will get there. The thing is also, remember, obviously her eyes are going to be itching, and she's going to be rubbing and rubbing and rubbing, and that is actually really bad for your eyes. And you can get problems from that as well if that is not addressed. So it is very important to make sure that maybe while you're waiting to see an allergy specialist, maybe if you haven't seen someone yet, maybe while you're waiting for that, use your ointment and make sure that you get that inflammation under control, because leaving that is actually worse than well, sounds silly, but not treating it is really not a great idea.
And I think just one more thing, if I may add this, Rita, is that if she's only allergic to dust mite, it's a good thing. Obviously, we would need to assess properly with the allergy test, but actually, Charlene, the best news for you this evening, I know we'd be telling you all the bad things about eczema, but we have a cure for dust mite allergy. So often people are allergic to lots of things. We call them polysensitized, and then you can't cure one allergy because you're actually not going to win. If you're allergic to 10 things, there's no point curing one. But when it comes to house dust mite, grass pollen, dogs and cats, we have something called immunotherapy, which is basically desensitizing. It's like a vaccine for an allergy. And if If your child's highly allergic, if it's a really bad level, depending on her age, we obviously very selective. Allergists in particular are very selective of who we choose to desensitize. And if she's a good candidate, many of my patients with bad eczema, as teenagers, if they were only allergic to dust mite, I've cured the dust mite allergy over a 3-year course, and actually it's changed their lives. So it is something that is an option for her. There are many options for her.
Sure, we got some great questions here. But so there was another one that I actually also wanted to go to. There was a question on my daughter had an IgE result. What is an IgE result? Tulja, please tell us what that is.
So an IgE is basically the level of what, when we're checking for allergies, we were talking about type 2 inflammation earlier. So an IgE is a part of your immune system, which basically picks up and tells us what you're allergic to. I think that's the simplest way of explaining to somebody. Now, the reason why it's so important, and that's such a great question, Sarita, is because I see there's some viewers who are talking about food allergies as well. I think it might be this part of the same question. Yes, IgE is the molecule which we use to assess if somebody is going to have an allergic reaction to something. Now, there are many tests that are unvalidated. And this is a global problem. We do have some laboratories in the main cities in South Africa. There's one in Cape Town, one in Johannesburg, and one in Durban as well, that offer something which they call IgG tests, right? Now, Ig stands for your immunoglobulin. The immunoglobulin E, which is your IgE, is the one which is relevant for allergies. IgG is a test which is not relevant for allergies, and it's a test which is not done by doctors, but a lot of parents are often sold into buying an IgG allergy test. And let me say, this is something that's agreed upon by specialists globally. IgG test is not something we recommend. It is not validated. And often they pick up lots of different food allergies. So lots of people get told, stay away from cow's milk, no more dairy for your kid, no more wheat for your kid. In fact, every single person who's had an IgG test gets told that. No more wheat, no more spices, no more dairy. If your child has tolerated these foods and is not reacting to them, your child can't be allergic to them. So that's why, your question was so good. IgE is the molecule which we assess to check for an actual allergy, not IgG.
Yeah. So for those of our viewers who must tell, maybe I can also just say that it's the antibody. So everyone will know about antibodies now after COVID. And all those vaccines, because I'm sure it was in the media everywhere. So yes, so that's what they're. But shame, if you have a positive allergy test for eggs, milk, soya, peanut, and wheat, then you have to go straight for the expensive foods, isn't it? So you can't even go for so mom has to really struggle to buy anything. What
I would say to that mom is that I still do think that a mom like her, firstly, must see, wherever you are, you must see an allergist, because food allergies are part of what we call the atopic or allergic march. Your child probably presented earlier on when they were born with cradle cap or a dry scalp. You might be either nodding yes or no if you're still watching our live. And then some of them do develop food allergies. Now, the problem with those IgE tests is we now have advanced in our allergy management and diagnosis where we actually check specific proteins with the IgEs as well. So it's often important for an allergist to assess those blood results, because sometimes if this child, and I'm not sure if this child has drank milk in the past or has eaten egg or has eaten wheat and not had a reaction, then chances are she might not be allergic, and perhaps her specific proteins might be negative. So, the IgE is a whole level, and within that, there's a specific test that we do that tests which proteins are relevant for an allergy and which proteins are not relevant for an allergy. So for this mom, I would say that I do think either you do need to see an allergist, or at least get an allergist, have a look at your blood tests, or maybe further investigate. Because like you said, Sarita, that's a whole other talk. But now with foods, whenever I talk about milk, because I know it gets blamed a lot, even for skin issues, I always put up a slide for my patients and for even healthcare professionals saying that this is what normal milk in South Africa would cost. It's between 12 and 15 rand a liter. And this is what a plant-based milk would cost. It's 55 rand a liter. So when you're telling a parent or you're telling somebody that you're allergic to cow's milk and you must stay away from it, it's so easy for you to say that, but that's what you're doing to that person for the rest of their lives. And honestly, not everybody can afford to be allergic to milk these days, number one. And number two, growing children need to have cow's milk protein for the vitamin D and for the calcium for their teeth and their bones. And number three, particularly with milk, most kids who have milk allergy ought to grow out of their milk allergy. So, if we manage them properly, 90% of children should grow out of their milk allergy. So, these are the reasons why this child would need to be assessed properly.
Yeah. So the very complex, if you have very severe eczema, and her child does have really severe eczema, especially with all these other problems as well, then definitely need to see an allergy specialist. And will they outgrow it? Well, that's something that I would like to take, if you don't mind, because that's one of the things that I always advocate when I speak to, when I give lectures to healthcare practitioners, and also when we have chats on these live feeds as well, and I support group meetings. Very important for my healthcare practitioners, for my colleagues. I make sure that they are very well aware, and that they make patients aware and parents aware that you don't necessarily outgrow this, and that only about half of cases will outgrow it by the age of puberty. But even if you do outgrow it, it can still pop up because it's always part of your body. It's always there. And you may be very fortunate that you don't struggle with it anymore, but very often in adults, it'll come out in hand eczemas. So I see a lot of hand eczemas now, and I think that this is something that was really triggered by all the hand sanitizers. So I must say, in my practice, I see that a lot now. So outgrowing it. So we actually, I can talk about these questions, and I can chat with you all evening, because we're just learning so much from you, and it's so exciting that we have so much interest tonight. So it's really great. But what is very important for me is to make sure that everyone in this audience knows you may have come to us through the Facebook support group or the Instagram support group. But if you are not aware of that yet, we do have a Facebook support group that I manage and or I oversee. Of course, this is not a consultation forum, unfortunately, when on the Facebook support group. But what I dream of one day is that people know that they're not alone, and that's one of the very important things, that they know they're not alone out there. So if mom is struggling middle of the night, baby's skin looks bad, then please reach out, and we may not respond immediately, but maybe someone else is awake. Maybe someone else with eczema is awake, and they want to, they want to respond to your question at that time. So yes, the Facebook support group, and it should be under. I think if you're in YouTube, then you should be seeing at somewhere along the hopefully underneath, or there will be our link to our Facebook support group. It is a closed group, so if you try to join, then make sure you answer all the questions, because if you don't, I won't allow you. So just make sure that you answer all the questions. Okay, so and then the other thing is also we're going to move on to, because we'll have more time for questions, but we're going to move on to Warwick's video. Now, some of you may have seen him last year. I think it was in September, when we had Dr. Nofal Rabubi from Durban on this Facebook live that we had then. Sorry, I'm going to keep on saying Facebook. I'm too old for these Instagrams and YouTube things, but forgive me. And he showed us a video of Warwick, one of his patients, that had an unbelievable response to the medication that we're going to talk about a little bit later as well. If we can move on to that now, please. I think that would be a great next step for us in the conversation.
You had your first Dupixent injection. What was your experience?
Yeah, it was awesome. Yeah.
What
It wasn't too bad. At least I'm on the healing process now. So
What difference did you
things can only
see?
get better from here. Yeah, I've healed up a lot now. I just need to get rid of a bit of scarring.
Where were the severe areas?
The severe areas were on my arms, everywhere. My whole body was covered.
Right.
Now I'm feeling.
And on the wrists, right?
Yeah. I just need to get rid of some scarring now.
Yes.
But otherwise,
So those have done
my
well.
hands were terrible.
Yes. What difference does it make to your sleep pattern and the itch?
Yeah, I can sleep a lot better now. I'm less itchy.
Yeah.
Going back to gym, getting fit again. So
How long did it take after the injection for the rash to start disappearing?
I felt a difference almost straight away. Within a week, it started clearing, and yeah, now it's been, I think, 3 weeks or 4 weeks, and I'm almost healed. So it's very good.
Would you
Can't wait
recommend
for
this
the
to others?
future. Yes, definitely. It's changed my life.
I'm glad it's made a difference to you, and good luck.
Thank you.
Thank you.
I just smile because not only because this patient had an amazing response, but also I just love Nofal, my colleague there in Durban, he's just such a passionate man and is just such a character. So this medication, did he mention the medication? Was it the biologic, that he was taking, if I remember correctly?
Yes, I think
Sorry, Tilja, maybe you can tell us a little bit about the biologic.
Okay, so we were talking about the inflammation, the type 2 inflammation, right at the beginning of our interview, where we were discussing how there are different cells in your body that actually cause this inflammation on the top levels and the top layers of your skin. Now, when we and both of our work is tied, you as a dermatologist and me as an allergist, we treat what we see on the patient. So when we see dryness, we treat the dryness with good emollients. When we see inflammation, we treat the inflammation with anti-inflammatories based on, how strong there is a need for. But coming back to what the actual root cause of the eczema is, and that inflammation and those cells that are involved in actually causing the inflammation, the problem is this is why patients struggle, and they go through cycles and cycles and cycles of getting better, getting worse, getting better, getting worse. We call them periods of flares and periods of remission, is because that type 2 inflammation is still there. So biologics are basically, and the way I like to explain to patients is, and because this is a very nice word, umbrella term, precision medicine, because with precision medicine, it actually is taking every disease. So it's not just for atopic dermatitis, but taking any disease and going all the way down to a cellular level, down to the root cause to say, well, what is that cell in my body that is actually causing my skin to be red or itchy or dry or inflamed compared to the other normal person who doesn't have eczema? And that cell there now has, through years of research, been targeted, and we know which is the one that is the culprit in atopic dermatitis. They're what we call interleukins. So interleukins are basically parts in our body that trigger off an immune reaction and inflammation. And basically what precision medicine does is it takes a group of drugs, we call them biologics, and it goes and it says, well, what we're going to do is we want to halt that process in somebody's body so that they don't keep getting itchy and inflamed and dry and what. And those are the things we're treating. So I think in a nutshell, biologics are something that's very, we use the word targeted, but it's actually targeting the root cause of any disease in comparison to us just treating the symptoms. I always use the example of high blood pressure because you mentioned hypertension. When somebody has high blood pressure, we use a medicine to bring the blood pressure down. So I always tell my patients what the biologic does. It says, well, what's causing your blood pressure to be high? That's what we're going to treat. We're not going to bring the blood pressure down. That's not what we're doing. We're actually going to treat what's going on inside. Yeah. I don't know. I do have a lot of experience with biologics as well, Sarita.
Yes. So those interleukins, they're basically similar. I can compare it to a key that turns the lock, isn't it? And switches on the inflammation. And so what we try to do is we try to block that. So we basically either putting something on the key so that the key doesn't fit, or we're blocking the lock so that the key doesn't go into the lock to switch on the inflammation. So that is what a biologic is. Now, what we've been talking about, the only biologic that we have registered in South Africa at the moment is dupilumab, so Dupixent. And yes, this is, I see this fascinating question here. Someone was saying that long ago they had to bring in, get special requests to bring in certain medications, etc. This Dupixent, and yes, Dupixent is available in South Africa now, but it's very expensive still, unfortunately. And usually. It may be a little bit more affordable now than it used to be in the past, because we don't have to jump through hoop, and we don't have to jump through get approval from the government to bring it into the country, or SAHPRA to bring it into the country. It's already in the country. Now we have to get funders, unfortunately, to approve it, and that is where the two of us struggle every day, isn't it? And someone else asked, oh, sorry, go ahead.
Yeah. So, I mean, and I know you feel the same way, Sarita. If I could, if I had a magic wand to get a biologic for all my patients with atopic dermatitis,
definitely,
I would do it. Unfortunately, the financial aspect is one of the biggest barriers for us as doctors, because they're highly expensive. We have to consider that a lot of patients have already spent so much money on their condition and have to budget for this, even if it's a consideration and this is something that they want to do. And also, some patients just actually can't afford it because it is not affordable. Unfortunately, I don't know if we should mention the name of specific funders. I don't think that would be right. But Janice, who posted a question, unfortunately, many of the insurers are not on board. And the one that you've mentioned specifically is less likely to cover Dupixent, which is the biologic that Sarita and I are talking about. Immunotherapy, on the other hand, Janice, is readily available across South Africa. It is not covered at all by any medical aid ever, unfortunately, but it's much more affordable than a biologic. But obviously with immunotherapy, it would depend on if you're a good candidate. And if there is immunotherapy available for that which you are allergic to. So yes, that is it. Both are the immunotherapy is non-SAHPRA, even though it's been available for a long time in South Africa, but it is readily available and more affordable.
Yeah, the thing is that I think that, and this is also what I said to my colleagues yesterday. When we had a meeting on the dermatologists had a meeting on this atopic dermatitis treatment. We have two medications approved in South Africa now, these special targeted treatments that are, and one we're talking about tonight is Dupixent. But there are about 70 in development, at least. So it's a very exciting time for atopic dermatitis, and there will definitely be big things to come, and soon as well. So I don't think we must give up on that. And doctors fight every day with the funders to try but what is important is you're going to need to know that there are options, and you need to ask your doctor for it. And if you're not at a dermatologist or an allergist who can help you with that, then it's important to move on to or ask to be referred to a doctor who can help you with that. Regarding a question, I'm sorry, I'm going to jump in there, Tulja, because I saw a question here that I think is important. One of the patients asked whether biologics for eczema is only available in private. And I can tell you, working in both sectors, that it's not. It's also available to the public sector, but very, very few patients can be, unfortunately, because the health budgets are what it is. Unfortunately, it will still be a problem to get it approved in the public hospitals. Some hospitals have a little bit more lenience, a little bit more leeway with their budgets, but I know that it is quite challenging to get it. But doctors, if you have the right doctors, then they will keep on fighting with you, and they will definitely help you to try and get further with that. But as I said, I think it is early days and it's exciting times, and we can do things about it. So you need to get to the right doctor, and then you need to try and address, and then need to take on these funders as well if you're in. So keep on asking, because if you keep on asking, somewhere this wall is going to break. The dam wall is going to break, and somehow we will be getting access to these medications. So keep on doing that. So, okay, so let's see. Do we have more questions that we can have a look at? Tulsa, do you see anything there that I've missed that is something that we can
I'm just with regards to the question with that Tumelo Lizzie posted about the foods and the skin as well. I think just important to know that apart from the food allergy being there and your skin allergy or your atopic dermatitis being there, that the food itself and the exposure to the food itself at that young age, if your child does have the food allergies, like I said, it would need to be assessed properly. Those tests need to be assessed, but that is something that in itself can trigger off the eczema. So just something simple like, if your child's allergic to peanut, kids in the classroom who might eat peanuts and touch a pencil or a crayon after eating a peanut butter sandwich, and then your kid might touch the same pencil or crayon, unbeknownst to your child or you, that might just trigger a little bit of inflammation on the hand. The child will start scratching the hand, and now when you fetch them from school, there's a flare on the hand. So just really, really important to know, in terms of the inflammation, that all of this plays a role, the foods and the environment in the atopic eczema as well. I see there is another question now as well, Sarita.
There's one question here that I'm going to go to that, but almost the very first question that we had tonight is about whether we will be able, if you go onto these targeted treatments, if you start with the biologic, for example, whether you're going to still need other medications or not. And the normal treatment for eczema that we've been advocating for every moment I get the opportunity to speak to you guys, I always mention about the moisturizing therapy and avoiding the bad things, staying away from the bad things, doing the good things. I'm sorry if you're in the dark with this now, but if you go back on one of our previous videos that is saved on the Facebook group, actually, you'll be able to see where we talk about staying away from the bad stuff. So just shortly, that's water and that's soap, staying away from the bad stuff, but soaps that foam, bad stuff, but doing good things. So moisturize, using a soap substitute, those things, and then obviously a few other things as well, but those are probably the most critical things there. Moisturize, moisturize, moisturize. With the right moisturizers, because there are bad moisturizers out there. So try to keep it as simple as possible, and try to stay away from the perfumes and try and stay. But choose a moisturizer that you like and that you can afford, because you're going to need a lot of it. Okay. Then the other thing is you will still sometimes need a cortisone cream or a similar thing, something like Protopic, those type of creams that we're familiar with. Still need that every so often. One of the other things also, Tulja, is that the problem also that I found with the fact that with the whole biologic and targeted treatment is that people have to use it for the rest of their lives, really, unfortunately. So they may be lucky and they may not need it anymore. But unfortunately, the majority of cases, we are looking at long-term treatment. And that's what makes it very difficult for funders because, to try to commit to things like that.
Yes. And also what I'd like to add there, and this is also adding to Sarita talking about all the other treatments that are coming out with all the research. It's a very exciting space. With the inflammation that is attacking the skin, that same inflammation comes from the immune system, which is affecting the nose and affecting the chest. And I think I see a lot of the questions people are saying, they have asthma and they've got nose issues, skin issues as well. Is these interleukins that Sarita was talking about, the two specific ones that the biologic that we're talking about targets, Dupixent, is interleukin 4 and 13. Now, those interleukins, because all of this inflammation, be it your skin, be it your eyes, be it your nose or your chest, it all comes from a similar place, and it's your immune system having an abnormal response. These interleukins are also impacted with your nose and your chest and stuff. So it's very exciting for us as allergists because people come to us with really bad skin. We're using a biologic because their skin is really, really severe. But actually, this inflammatory process has affected their whole body. So actually stopping the key, turning the inflammation impacts everything. In fact, in USA, Dupixent, which is the biologic we're discussing, has been approved for asthma as well. So really, really exciting, that even though we're treating the skin, that this is going to have a ripple effect. But I agree with Sarita, is depending on the patient, I still keep my patients on medication, but obviously every few months we review them. And sometimes if a doctor's given you a tube of steroid, perhaps after 6 months or a year of a biologic, you don't actually need even a steroid anymore. It could be diluted. And then after a few more months, diluted even more. So the idea is less medicine, better control.
Yes. So we're moving on to the last part. We're just going to finish off now. One thing that I forgot to say, and this is very, very important, is that in South Africa, this medication is only approved from 18 old and older. So at this stage, we can't give it to children in South Africa yet, although it is approved abroad. So in the USA, it's actually from 6 months and on, I think. But
so, I think it's very new. We must just confirm, but it has been approved now of recent, even with children in South Africa. Yeah. So it has been, yes, it has received approval recently. I'm not sure if it's in black and white yet, but I think it's from 6 years of age. But look, I mean, that is something I think you need to discuss with your sister, I think.
And we're actually going to and this is what is, we keep on training and we keep on learning. So we're going to a meeting this weekend, the two of us, and we're going to be meeting up with some of our colleagues in Johannesburg, and we'll be discussing this further. And so there are doctors out there that are interested in eczema. So please don't feel that you are left in the lurch, and we really are trying to help as well. So Tulja, thank you very much for coming tonight and spending your time with us. And I'm sure that we will have you over again if you would be available to discuss more, even more IgE questions, for example, because we see some more questions there coming up. Maybe the next time.
Thank you so much, Sarita. It's so fun and it's so lovely chatting with you. And like you said, and we're going to be collaborating more. You need to, I think for the patients, you need to go to doctors who are constantly searching for new things, constantly looking for answers for you and constantly fighting for you as well. I think, both of us are very passionate because we have firsthand experience with patients. And I think, like you said, the most important thing, the take home here is patients need to know that they're not alone. We understand how badly it affects them and that there are things that can be done.
Yeah. And then the other thing is then I also, but thank you very much for your time, and then thank you for all your expertise. It was absolutely wonderful. And then I would like to thank everyone for joining us tonight, and thank you for the questions. We just had so many to choose from. It was fantastic and interesting questions, and we are going to answer those questions for you afterwards as well. Join our support group, please. Our next meeting is going to be in July, if I remember correctly, but it will be advertised. And the next one, we're going to have Professor Carol Schleeler. Oh, sorry, I'm sorry, it's getting very late. Carol Schleeler on again, and from Red Cross Hospital, and she's going to be discussing something called steroid phobia. So we're and that is something where we know that people are very, very scared of using cortisones and cortisone creams, and we'll be discussing that next time. So I hope you are warm wherever you are, and that you have a good night, and that your eczema gets better quickly.